I'm Martin, the CEO of Vet Success, and I'm with Dr. Clayton McKay today. And perhaps I can just start, Dr. McKay, by just asking you to introduce yourself a little bit, tell us a bit about yourself, and we're going to have just a short conversation this afternoon.
Thank you, Martin. I'm Clayton McKay, a veterinarian. I've had the good fortune to be one for now over 45 years. I spent the first 22 years in clinical practice. Then I was an academic administrator as the director of the teaching hospital at the University of Guelph. And then I spent the last 13 years of full-time work with Hills Pet Nutrition as the director of veterinary affairs for Canada. And currently I'm doing private consulting on a part-time basis as I enjoy the work optional time of my career.
That's great, thank you. What I thought I would start with is just based on your years of experience in practice and also in industry, if you could maybe talk about the value of practice reports.
I don't think today, and particularly in today's veterinary medicine, that success no longer can depend simply on being a great veterinarian. You need to have proper practice management tools in place. And you cannot manage a practice today without good reporting, knowing what is exactly happening in there, and being able to take the data and be able to do something with it to improve your practice.
And so maybe I might ask, and you've talked a bit about this in the past as well, so what are some of the key practice metrics that you think that we should be looking at?
Given today's difficulty of declining visits to the veterinarian, particularly for preventive health care, we really need to know what's happening to the actual or active clients that we have in practice. So we need to know how many are coming in and how many are going away, and to make sure that we're ahead of that curve, that we are growing our new client base at a faster rate than it always moves away from us at the bottom end all the time.
Yeah, we talk a lot actually about watching those lapsing patients, right? So starting at 14 months before they actually lapse at 18 months, staying on top of that. That's the kind of thing that I think you and I have had some conversations about that in the past as well.
And I think that it's important that the data be really targeted onto several key factors, that there is just too many things that are there in an acronym I've probably used all my life, or a saying is, everything that can be counted doesn't necessarily count. And I find in visiting practices that have management problems, what is happening with them is they have so much data, they simply get confused by it and try and do too many things at once.
Yeah, we certainly, we've seen that a lot too. So maybe, as a last question I can ask, when you talk about trying to do too many things at once, realistically, how many initiatives can a practice take on in any given time you pick, right? In a year, for example?
In a year, that's a very short period of time. If the practice is there and it's sort of our normal 1.5, 2 doctor practices, oftentimes the veterinarian is also the manager of that practice. And so to be able to carry both hats, really I've only found success with doing one or at best 2 major changes to try and grow or improve that practice at any given time. Too often individuals take on too many things, and therefore none of them are really focused upon, and the entire project ends up failing at the end.
So just make sure that I'm connecting the dots. Too many metrics, too many numbers leads to too many initiatives trying to improve those numbers, and because you take on too much, you don't actually end up improving.
Yes, and I think that in many different ways, regardless of what they're actually working on, if they're working on too many things at once, and I certainly found that in my career in industry, we can't change the world overnight. It has to be done piecemeal.
Yeah, we find that in our business too. Just focus just stay focused, pick a couple of things, measure them, move on.
Right.
Wonderful. I'm really grateful for you spending some time with us today. Thank you so much.
Thank you. I've enjoyed it.
Thank you.